The U.S. now accounts for 1/5 of the world's coronavirus deaths, more than 500,000 people dead in this pandemic, a staggering toll. But there is some good news as hospitals are reporting declines in COVID-19 patients, prompting cautious optimism from doctors. But many still warn we still could see another spike if states keep rolling back restrictions and people start getting complacent. At the same time, the virus continues to mutate, and fewer than 45 million people have gotten at least one vaccine dose so far in a nation of more than 330 million. Here in Massachusetts, we're doing a lot better on the vaccine front. Now in the top 10% of the population that's received at least one dose, up from the bottom 10 at the start of the month, according to the Washington Post. But Governor Charlie Baker is still fielding criticism over several aspects of the rollout, including the VaxFinder website that crashed last week. The day after it went down, Health and Human Services Secretary Mary Lou Sudders blamed PrepMod, that's the vendor behind the website. But PrepMod's creator said the state never even told them about expanding eligibility by an extra million or so people the next day, telling the Boston Globe, quote, "I did not get a phone call that said we're about to kick it up a few notches." The governor is expected to testify about that and more on Thursday at the first of several planned hearings before the state legislature on the vaccine rollout, including on issues of equity. According to state data, Black and Hispanic residents still make up just 5 and 4% of people who've gotten at least one dose so far. To that end, the Baker administration has been pushing for community health centers to play a greater role in the vaccination process. But at the same time, the state is shifting its focus largely to mass vaccination sites like the ones at Fenway Park and Gillette Stadium.
The big message we got from the public was vaccinate, vaccinate. And there's no question the fastest way to do this is with high volume sites.
But there's big debate over whether that decision will advance or inhibit the state's equity goals. I'm joined by Michael Curry, who's on the governor's COVID vaccine advisory group. He's also the president and CEO of the Massachusetts League of Community Health Centers and chair of the National NAACP Advocacy and Policy Committee. And again, I should let you know to head off any complaints that we're not letting the governor's office itself weigh in. We did reach out to the Secretary of Health and Human Services, who runs the state's COVID response, again today, for the 23rd time since the pandemic started. Once again, we're told she's not available. Michael Curry, thanks so much for joining me.
Anytime, Jim.
Michael, when you were here exactly 20 days ago, you had a few days before been at a press conference with the governor in which you said the goal will be and is equity. And I asked you if implementation was matching the goal, and your response was no. Are we doing any better 20 days later?
You know, I think the numbers are showing some progress, right? Whether it's the rates of infection going down and being a little bit more controlled, some of that's post-holidays, whether it's some progress that's being made through the introduction of the Reggie Lewis Track and Athletic Center, or the resourcing and dosing of community health centers to really meet the challenge of getting these vaccinations out. Some amazing work. I want to just lift up Boston Medical Center that opened up a vaccination site at Morningstar Baptist Church, my home church, in partnership with the Mattapan Community Health Center and Bishop Borders, the bishop of that church. There's some amazing and really powerful things that are going on, but we're not where we need to be. As I've said, Jim, and you've heard me say before, those closest to the pain still are not those closest to the vaccine.
Well, I know the governor has also prioritized, while he's stopping shipping to most municipalities, the 20 socially vulnerable communities, which I know you care about a lot, are getting vaccines. But the numbers are still there, Michael. 2/3, according to state data that I saw this afternoon, 2/3 of the first doses to white people in the state, a total of 9% between Black and Latinx people. I mean, that is so wildly out of whack. It's insane.
Well, you know, I've said this before, and I'll continue to say it. None of this should be a surprise. It's our healthcare system. And our healthcare system, as we've had this racial reckoning in this country, like our education system, our criminal justice system, disadvantages people of color. It disadvantages immigrants. And we should have known in a pandemic that those would be the people that would be least likely, I should say, to be able to get tested, that would be the most distrustful, and that would likely not be able to navigate the complexities of getting a vaccine appointment. So we should have known all of this. And I do think, you know, Jim, compared to some southern states, and I talked to my colleagues across the country, where some of their elected officials don't care. We know that, and I've talked to Secretary Sutters often, the Health and Human Service Secretary, she cares. Monica Burrell at DPH cares, and they work for a governor that cares. But caring isn't enough. The challenge is, how do you translate and operationalize that caring into something that gets equity? And I think we're better off than many other states in that regard, but we are in a system that was never really built to be an equitable system and is playing out.
Michael, I said a couple of minutes ago, the governor is going big time on these mass vaccination sites. Vaccinate, vaccinate, vaccinate. He said Natick, I think, opened today. Dartmouth, I believe, is opening on Wednesday. Do more mass vaccination sites advance or inhibit the goal of greater equity in the vaccination rollout?
You know, I would say when people talk about the various options of vaccination sites, I say the answer is E. It should be all of the above. We know we need mass vaccination sites because we know we need to get to herd immunity, whatever that number is, 80+%. That's about getting a critical mass of Massachusetts residents vaccinated. So we have to get there. Vaccination in a mass site makes sense. We also know that people will not be able to drive to Gillette. They will not trust or be able to travel to Fenway Park. And I think there's a new site that just was announced today. There's a mass vaccination site. Those are all good, but they're not enough.
The Natick Mall.
Natick Mall. Those are all excellent, but they're not enough. And I think that the part of resourcing community providers, community-based organizations, churches, and resourcing health centers to meet the moment is critical. If we don't do that, the disease, the hospitalization rate will remain high for Black and brown people, for immigrants, and we will see a longer runway to reopening for those communities.
But, you know, Michael, you said a minute ago, I select E, all of the above. You can't select all of the above because, as the governor said regularly, we were getting, 110,000 doses. I think it's up to 130,000 a week, something like that. He just added 1 million people, 65 plus, and people with 2 or more specific health care problems to the list. So it's got to be either or to a great degree. I know a ton of effort is now being directed at what you do, these community health centers, less so at local public health commissions, which is upsetting a lot of local people. Why are you a better choice?
Well, I think, one, local public health departments are critical. So, you know, I am an advocate and will beat the drum that we should have resourced public health departments. They should have had more staff. We have a fragmented public health system in Massachusetts and across the country. And therefore, we're realizing the pain in this moment that we defunded, and I use this term everywhere I can, Jim. We defunded our pandemic response. We defunded our emergency preparedness and our public health department. So we need to now have that reckoning about how we deal with public health. That being said, community health centers, born out of civil rights, closest to the ground. We speak those languages. We know those cultures. In fact, when you walk into a health center, the people who work at the front desk and even likely the doctor who treats you or the staff who greets you look like you. They come from your communities. They share your culture, whether you're Russian, Cape Verdean, or Haitian. And that is why both on the Biden level and across the country, people are starting to look at community health centers because we do vaccinations. That's what we do. Some others are jumping into the vaccination work, but health centers have always done vaccinations for our communities.
I wanted to read you one more quote from the Globe the other day. It's John Carrier, who's a system dynamics specialist. I have no idea what that is, at MIT Sloan School. Here's what he said about the whole issue of community-based versus mass vaccination. A centralized approach, especially in densely populated areas, makes good sense, even if some residents can't get shots right away. To get to herd immunity, an unfair system that moves quicker may be more fair than a fair system that's 6 months late. What's your reaction to what he had to say?
You know, the fortunate thing about policy is that there should be more voices in the room and people to push back on perspectives like his, right? We saw with crisis standards of care, if we let, which essentially was white folks decide who gets a ventilator, Black and brown folks who have comorbidities, who have those conditions, wouldn't have seen a ventilator, right? They could have been deprioritized, if that's the right word, and not provided a life-saving tool. To his point, no, it's not just about getting to herd immunity. It's about getting there equitably. And, you know, I appreciate other perspectives, but I'm glad that there's more voices at the table because as my predecessor, Jim Hunt, used to say, if you're not at the table, you're on the table or you're on the menu. And there's more of us like myself in the governor's working group at the table to at least advocate that we not be on the menu.
Glad you're at the table, Michael Curry. Good to see you. Good luck with your work. Appreciate it.
Thank you, Jim.